Just a short video here about osteoarthritis of the knee joints. It is very common as you get older, and you don't necessarily need to go for knee surgery for it. It is often as we get a little bit older, our cartilage starts to get a little bit thinner, which is completely natural and normal. Sometimes you get a few little potholes and things in that. But to try and reduce your risk of getting severe symptoms, if you can try and keep your weight down a little bit, so trying to just not eat and drink quite as much, which means that there's less pressure onto the cartilage and the knee joints and your muscles, that will greatly benefit it. If you keep doing some regular exercise, if that's walking or cycling, both of those are less impact compared with running, although very few marathon runners actually have knee arthritis. One belief is that it's down to their being a little bit smaller than the average person with weight-wise, and they've kept themselves active, so the cartilage is used to taking impact through it, so then it's non-symptomatic and it's nice and strong. So if you can get out and do some regular exercise with that exercise, being cycling or walking, that will reduce your symptoms, or simply just bending and straightening your knee gets the synovial fluid over that area, and that helps to sort of lubricate the joint and get that working. Other things that help reduce your symptoms are getting your muscles nice and strong, so some form of strengthening exercises. And one of my personal favourites, which you could do anywhere, is a sit to stand. So I'm currently on my little stool, bringing my feet back just slightly underneath me. I'm going to be pushing up through my midfoot, which means that my calf muscles activate as well as my glutes, rather than just all the pressure onto my knees. So pushing down through my midfoot. I'm going to put my hands over my chest, but you can put them wherever you'd like. And we're going to get you to stand up, pushing down through there. And as you stick your bottom out to sit back down again, the weight goes down through onto your heels and relax yourself back down. All you have to do is 5 or 6 or up to 10 of those, just to get those leg muscles working. But if you can think about pushing down through your midfoot as you're coming up, that reduces the load onto your knee, and you get those muscles working in not only of your calves, your glutes and your quadriceps, which are your thigh muscles, your calf muscles at the back, and your bottom muscles. As they work all together, they help each other out, rather than what often happens is your thigh muscles are working far too hard, then they start to irritate the knee joints, and your calves are a little bit lazy, and your bottom can sometimes be a little bit lazy, especially if we're doing a lot of sitting, especially during lockdown, working at our desks and so forth. So if you're suffering with knee pain, give some of those a go to try and reduce the chances of first of all getting knee pain, and if you are receiving some symptoms of it, then try some of those exercises to see if you can calm it down a little bit. But if you'd like us to have a look at it at Baslow Physiotherapy, then feel free to telephone us or email us at Baslow Physiotherapy, and we'll have a look and do some hands-on treatments with either acupuncture, joint mobilizations, but we'll give you a individualized exercise plan to get you back on track and get that knee joint working nicely, and get you back doing your current and future hobbies.